Migraine is a neurological disorder characterized by recurrent headaches that can cause moderate to severe pain. It affects millions of people worldwide, significantly impacting their quality of life. Despite its prevalence, migraine remains widely misunderstood. In this video, we'll delve into the intricacies of migraine, exploring its causes, symptoms, and various management strategies. Understanding migraine. Migraine is not just a headache. It's a complex neurological condition involving a variety of symptoms. While the exact cause of migraine is still not fully understood, researchers believe it involves a combination of genetic, environmental, and neurological factors. Causes of migraine. Genetics. Migraine tends to run in families, suggesting a genetic predisposition to the condition. Neurological factors. Changes in the brainstem and its interactions with the trigeminal nerve, a major pain pathway, are believed to play a crucial role in migraine. Imbalance in neurotransmitters, fluctuations in serotonin levels, which help regulate pain in the nervous system, may contribute to migraine attacks. Triggers. Certain factors, such as hormonal changes, stress, lack of sleep, certain foods or drinks, and environmental stimuli like bright lights or strong smells, can trigger migraines in susceptible individuals. Symptoms of migraine. Migraine symptoms can vary from person to person, and even from one attack to another. The hallmark symptom is a severe headache, often accompanied by other symptoms such as throbbing or pulsating pain on one or both sides of the head, sensitivity to light, sound, or smells, nausea and vomiting, visual disturbances, such as flashing lights or blind spots, aura, tingling or numbness in the face or extremities, difficulty concentrating or focusing, fatigue or lethargy. Types of migraine. There are several types of migraine, including migraine without aura. This is the most common type, characterized by moderate to severe pulsating headaches, without preceding aura symptoms. Migraine with aura. Some people experience specific warning signs, known as aura, before the onset of a migraine attack. Aura symptoms can include visual disturbances, sensory changes, or difficulty speaking. Chronic migraine. When migraine attacks occur on 15 or more days per month for more than 3 months, it's considered chronic migraine. Hemiplegic migraine. This rare subtype of migraine causes temporary paralysis or weakness on one side of the body before or during the headache. Management strategies. While migraine is a chronic condition with no known cure, several management strategies can help reduce the frequency and severity of attacks and improve quality of life. Lifestyle modifications. Identify and avoid triggers, such as certain foods, stress, and irregular sleep patterns. Establishing regular sleep, exercise, and meal routines can also be beneficial. Medications. Over-the-counter or prescription medications may help alleviate symptoms or prevent migraines from occurring. These include pain relievers, triptans, anti-nausea medications, and preventive drugs such as beta blockers, antidepressants, or anti-seizure medications. Stress management. Practicing relaxation techniques, such as deep breathing, meditation, yoga, or biofeedback can help reduce stress and tension, which are common migraine triggers. Dietary changes. Some people find relief by avoiding specific foods or ingredients known to trigger migraines, such as caffeine, alcohol, artificial sweeteners, and processed foods containing MSG or nitrates. Alternative therapies. Acupuncture, massage therapy, chiropractic adjustments, and herbal supplements are among the alternative therapies that some migraine sufferers find helpful in managing their symptoms. Foods to eat. While specific dietary triggers can vary from person to person, some foods may help reduce the frequency or severity of migraine attacks. These include magnesium-rich foods. Incorporate foods high in magnesium, such as leafy greens, nuts, seeds, whole grains, and legumes, as magnesium deficiency has been linked to migraines in some individuals. Riboflavin, vitamin B2. Foods rich in riboflavin, such as dairy products, lean meats, eggs, nuts, and green vegetables, may help prevent migraines in some people. Omega-3 fatty acids. include sources of omega-3s, such as fatty fish, salmon, mackerel, sardines, flax seeds, chia seeds, and walnuts, as they possess anti-inflammatory properties that could potentially reduce migraine frequency. Hydration. Drink plenty of water throughout the day to stay hydrated, as dehydration can trigger migraines in some individuals. Foods to avoid. Certain foods and ingredients are known to trigger migraines in susceptible individuals. While triggers can vary widely, common culprits include caffeine. Excessive consumption of caffeine or sudden withdrawal from caffeine can trigger migraines in some people. It's essential to monitor caffeine intake and avoid abrupt changes. Alcohol. Red wine, beer, and certain spirits contain substances like tyramine, histamine, and sulfites, which can trigger migraines in some individuals. Moderation is key, and it may be helpful to identify specific triggers within alcoholic beverages. Processed foods. Processed foods containing additives such as MSG, monosodium glutamate, nitrates, and artificial sweeteners have been associated with migraines in some people. Reading labels and opting for whole, unprocessed foods whenever possible can help minimize exposure to these triggers. Aged cheeses and fermented foods. Some aged cheeses, as well as fermented or pickled foods like sauerkraut, contain tyramine, a substance that can trigger migraines in susceptible individuals. Limiting consumption or opting for fresher alternatives may be beneficial. Treatments. Acute treatments. Over-the-counter pain relievers such as ibuprofen, acetaminophen, or aspirin can help alleviate migraine symptoms when taken at the onset of an attack. For severe migraines, or those resistant to over-the-counter medications, prescription triptans or ergotamine derivatives may be prescribed. Preventive treatments. For individuals with frequent or severe migraines, preventive medications may be recommended to reduce the frequency and severity of attacks. These include beta blockers, calcium channel blockers, antidepressants, anticonvulsants, and Botox injections. Non-pharmacological treatments. Alternative therapies such as acupuncture, biofeedback, cognitive behavioral therapy, and transcranial magnetic stimulation, TMS, have shown promise in migraine management, either as standalone treatments or in combination with medication. Complications. While migraine attacks themselves can be debilitating, they can also lead to various complications, including medication overuse. Headaches. Overuse of acute migraine medications can lead to rebound headaches, perpetuating the cycle of frequent headaches. Emotional and psychological impact. Chronic migraines can significantly impact emotional well-being, leading to depression, anxiety, and decreased quality of life. Disrupted daily activities. Severe migraine attacks can interfere with work, school, and daily responsibilities, leading to absenteeism, reduced productivity, and impaired social functioning. Prevention. While migraine prevention strategies may not completely eliminate attacks, they can help reduce their frequency and severity. Some preventive measures include identify and avoid triggers. Keep a migraine diary to track potential triggers, such as food, stress, sleep patterns, and environmental factors, and take steps to minimize exposure to these triggers. Establish a regular routine. Maintain consistent sleep, meal, and exercise schedules to help regulate biological rhythms and reduce the risk of migraine attacks. Stress management. Practice relaxation techniques such as deep breathing, meditation, yoga, or progressive muscle relaxation to reduce stress and tension, which are common migraine triggers. Stay hydrated. Drink plenty of water throughout the day to stay hydrated, as dehydration can trigger migraines in some individuals. Medication. If migraines are frequent or severe, talk to your healthcare provider about preventive medications that may help reduce the frequency and severity of attacks. Migraine is a complex neurological condition that affects millions of people worldwide. While there's still much to learn about its underlying causes, understanding its symptoms and triggers is essential for effective management. By adopting lifestyle modifications, utilizing medications, and exploring various therapies, individuals with migraine can better cope with their condition and improve their overall quality of life.